I'm Terry Rosell with Erika Blacksher, and this is an edition of COVID Ethics Update from the Center for Practical Bioethics. Thank you for joining us. So, Erika, we have a pandemic surge, if you didn't notice. Not just a pandemic, but things have been surging for some time. Hospitals are full to overflowing throughout the country, not just on the coasts or down in southern Texas. It's about everywhere now. Healthcare providers and public health experts are warning us about the darkest weeks of winter yet to come, perhaps, and are themselves resigning, doing other jobs, quarantining, out sick. Some of them have died. We have exceeded 350,000 COVID-19 deaths in the US alone as of January 2021. And we have a barrage of public service announcements pleading with us to do 3 relatively simple behaviors so as to stop the spread of coronavirus. And we have ample scientific evidence that those things work: mask wearing, social distancing, hand washing. And yet, a large percentage of the population, including many of my rural Kansas neighbors and extended family members elsewhere, many people still will not comply. So I'm wondering what you're thinking. I've been thinking about this, trying to understand what's been going on this past year in that regard. And I'm wondering what you're thinking. What's going on sociologically, ethically, such that we see these sort of behaviors?
Yeah, it's a good question, Terry. I mean, there is a bright spot. I mean, we ought to note that there was a survey in October that found that 72% of Americans say they always wear a mask when they're unable to maintain a safe physical distance from others. And with the significant surge that you just mentioned, deaths are happening everywhere, not just on the coasts. And which means, unfortunately, that a lot more people may now have been affected by COVID-19, seen people with COVID-19, lost people with COVID-19, and perhaps even more people will take up the practice of wearing a mask, because it appears that firsthand experience, experiencing someone dying or having COVID-19 really seems to matter to people, or at least some people, as to whether they'll take up simple measures like mask wearing. But still, I take your point. There are plenty of Americans who don't wear a mask. And since we're just surfacing from this holiday season, we might want to mention that we saw millions of Americans get on planes to gather with family and loved ones, despite public health officials pleading with people to just skip this year and stay home and stay safe. So to your question.
Reports of parties
Sure.
by political leaders over the holidays with large gatherings, not socially distancing, not masking.
Right. So it's a real problem. I don't mean to minimize it by noting the good news that, the majority of Americans do say that they are following the mitigation measures. So why won't people don a mask, right? Seems like a simple enough thing. And I don't know that there's been I can't find any sort of definitive empiric analysis that gets to the justifications, but you read the commentaries, you read firsthand accounts, and you just listen to people. And I'd suggest there might be 3 reasons why people aren't wearing masks. I think some people might question the efficacy of wearing a mask for either getting infected or transmitting the virus. And I'd say that skepticism might be attributable to the fact that the CDC did an about face, right? At first it didn't recommend it, and then about 2 months into the pandemic it did. So it could be that about face is fueling skepticism or maybe even causing confusion. But a second reason that I think is kind of a louder reason is that I think there are people who view mandates for wearing masks or recommendations for wearing masks as an infringement on their individual liberties. And perhaps they view that as constituting some strong form of objectionable paternalism, you know, the nanny state interfering with their civil rights. Certainly we've seen rallies and protests that suggest that this is fueling resistance among some Americans. A third point I'd make is that I've seen some analyses that suggest that people aren't wearing masks for reasons related to their identities, their cultural and political identities, right? Their political and social values, perhaps their race, their gender, so on. Mask usage appears to be more common among women, among older adults, and among people who identify as Democrats or left-leaning. This isn't to say that men or people who are politically more right-leaning don't wear masks, but data suggests that they wear masks far less often or not at all. It's important to note that studies show, and studies show it, but we've seen it all around us in our social media feeds and in our news feeds, that what people believe and do in response to the pandemic appears to be aligned with their political affiliation. With people who kind of lean right in their politics and maybe hard right, being far less likely to engage in and far more likely to reject mitigation measures like mask wearing, social distancing, and lockdowns. President Trump and his administration's high-level officials, we can all know because we saw it, did not wear masks for much of the pandemic and downplayed its seriousness. So some people may simply be following his lead, people who identify with his values. But Terry, that much is description. You also asked me what I think is going on ethically, and so I'll just note three things here. For those who think that the recommendation or even a mandate to wear a mask interferes with their individual liberty or is some form of unjustified paternalism, I'd remind them that individual liberty, as important of a value as it is, it's not the only value that's important in the American fabric. There are other values that are just as important. Indeed, these values are, I think, important if you're a member of the human community. Duties to do no harm, duties to protect the vulnerable, for example. And that leads me to my second point, which is that the recommendation to, or even a mandate to wear a mask is intended to protect not only the person wearing the mask, but also, and more importantly, to protect others from an unwitting carrier of COVID-19. The CDC now believes that some 40% of people with COVID are asymptomatic, which means they don't have symptoms, they don't know they have symptoms, they don't know that they have it, and yet they pose a serious harm to others they come into close contact with. So when public health intervenes on individual liberty to protect others from a serious form of harm, other regarding harms, we'd say, that's not paternalism, at least not in any ethically troubling sense. What is ethically troubling paternalism is when you interfere with an individual who knowingly and freely is choosing to harm himself or herself. So it depends on what you understand the mask mandate and the mask recommendations to be doing. I have a third point to make about solidarity, but I've been talking a while. So let me turn it back to you, Terry, and see if anything that I've said thus far seems to make sense. Well, what do you think is going on sociologically and ethically?
Yeah, I think you always make sense, Erika. So, what you have said does make sense of what's going on. I want to look at it from a different perspective, however. So not disagreeing with you, but putting on a different set of lenses, perhaps. As you know, I am a religious leader and teacher, as well as what I do for the Center for Practical Bioethics, and have been an ordained Baptist minister for nearly 40 years. So as I try to understand things within society that don't initially make sense to me, sometimes it makes sense to me if I look at it through the lens of religion. And that's what I'm doing a good bit during the last 12 months or so. what I see happening amongst a significant portion of the U.S. population, inclusive of many of my rural Kansas neighbors and my extended family members throughout the U.S., what I see is a practice of religion. It's not Christianity per se, though most of those people profess Christianity as well. But I think it is a sort of religious thing that's going on, and much of it cloaked in Christianity. So what is religion? There are many religions, some of them with deities and some without. What do religions have in common? They have various religious practices, objects of devotion, which again may or may not be seen as deity, sacred symbols, and others that are symbols that are not sacred, but representative of what we are not committed to, as whatever that religious group is. There are common beliefs and doctrines, concepts of good and bad values. There are rules for right and wrong, and rule keepers. There are sacred narratives, texts, stories. There can be magical thinking. Things that are thought to occur outside of nature, with different sorts of terminology for that. There are rituals and ritual leaders. And then there is the congregation, the group, in a sense of us and them. And it's oftentimes us versus them, in my experience of religions, including that which within which I grew up and function as a leader. Very often it's an us and them sort of thing. There's religious language, terms, phrases, and a worldview into which everything else that happens must fit in order for me to continue to ascribe to and practice any particular religion. So what has arisen in the political life of the US since about 2015 then looks a lot like religion to me. And so too the otherwise incomprehensible refusals to accept basic public health information and mandates looks to me like a manifestation of religion and religious adherence. So ethically then, what I think might be going on is something like religiously based refusals to comply with public health rules.
Mm-hmm. Like vaccinations being an easy example, which we make an exception for, although some states are clamping down on those religious exemptions because of outbreaks of infectious disease and kind of abuse of the exemption.
Right.
Right.
And the coronavirus vaccines, too, there are already narratives that have been created to try to fit that vaccine within the worldview of religions. Really, it's not just one, but and what leaders, what I'm calling religious leaders, are saying. They may be politicians, but they may also function within a particular religious context as religious leaders as well. And so if my religion and my religious leaders claim that a vaccine is dangerous, then I accept that vaccine at, contrary to the dictates of my faith.
Mm-hmm.
And faith and belief, versus fact is also a part of how we understand religions, talk within religions. Faith is held up as higher than anything else. If one has faith, that's a virtue, at least again within the religions that I am most familiar. If my religion and religious leaders claim that the coronavirus is a hoax of our enemies, or at least that it's no worse than the flu, then that is the truth with a capital T. If I am faithful to my religion and to my religious leaders, regardless of the facts to the contrary. Facts and science don't matter if you are one of the faithful. Belief matters, and upholding the beliefs matters. That's what's virtuous within many faith traditions, at least faith traditions. If my religion and my religious leaders don't wear face masks, if they mock those who do, if they claim that mask wearing may be harmful to you, in fact, or that masks are worn by those who want us to lose, and we don't want to be losers, then a mask becomes a symbol of what I ought not to be or do. It's what I don't wear, no matter how much you try to persuade me to do so, that it's the right thing to do for me and for others. I won't do it. Why? Because it's against my religion.
Well, that's a fascinating analysis, Terry, and a lot of what you say resonates. I wonder how, if you were to offer that up to those who refuse to wear masks, if they'd identify with what you describe or not. But something you say in particular, this us versus them kind of thing, reminds me of an analysis I saw that suggested that wearing masks or not wearing masks rather, was an expression of solidarity. So the analysis went like this: for people who don't wear masks, this analysis suggests that people were kind of joining in and taking a stand against government intrusion, government overreach, political scare tactics, the hoax, right? So people were joining with fellow Americans who share their views, their beliefs, maybe their religious beliefs, their identities, maybe is one way to think of that. And so that's one expression of solidarity, right? I'm going to join with people like me. But on the other hand, if we think about solidarity from a different perspective, those people who are wearing masks are also expressing solidarity in that they're giving up certain freedoms, certain civil liberties, going about their business without a mask, refraining from seeing people they love and family, et cetera, in order to stop the spread of COVID-19. So there you have solidarity, this idea of solidarity being used to describe people who both comply with wearing a mask and people who reject those mask mandates and mask recommendations. And that raises the question about, what does solidarity mean? And there are many different definitions of solidarity. I'm going to share one with you. And I would just note, solidarity is not a value we use much in America. I don't think we're tethered together. We don't have a strong sense of, solidarity as Americans. We have other values, but solidarity isn't one I think that frequently comes to mind. But here's a definition. It comes from the bioethics literature. Solidarity signifies shared practices reflecting a collective commitment to carry costs. Costs meaning financial, social, emotional, or otherwise. Carry those costs to assist others. So that definition, if we take that as a bare bones definition that has, a lot of overlap with other ideas of solidarity, seems to reflect the collective, seems to kind of share this commitment to wearing a mask, right? Because you're giving up stuff in order to protect people who are vulnerable to COVID. I don't know, what does that make any sense with your own sort of diagnosis of the situation?
Yes.
Does it fit?
It does. It fits very well with a religious lens to try to make sense of this. Solidarity isn't a term that we use much other than perhaps in ethics, moral philosophy. Um, and I think it may be a term that's much more familiar perhaps up in Canada, where I do read that and hear that more on the lips of people who aren't necessarily ethicists. But down here, it may be that that there isn't, we just don't use that term. There certainly is a whole lot of group identity, and persons who will do a lot of things for the sake of their group and for belongingness. So it might be that it happens, but under different terms, or again within smaller groups than the entire society, which is diverse. And diversity isn't a value for everyone or every group or every religion in the same way that it is for others. So um, I have seen people who are in this subset of the population who refuse to wear masks and believe things that public health officials do not believe. The facts don't seem to uphold so much as what I'm calling a religious faith perspective. And some of those folks just seem narcissistic, focused on their own good, but a whole lot of them are focused on their group and on what you're calling solidarity and a sense of doing what the group believes and needs. So if we focus exclusively on the libertarian sort of notion that this is all about individualism and individual liberties, I think we miss a whole lot that's accounted for better by looking at the value of solidarity or these group values, the sense that that what our leaders and what our people believe matters more than what public health leaders tell us to do. So yes, I think it is more a matter of groupness, and at least in some cases, than it is about individual liberties.
Mm-hmm.
And I have a sense also that we could go on and talk about a whole lot of nuances and other things pertaining to this, and that maybe we should save that for another conversation, because I think we're at about time for this COVID ethics update. So what I will say then is thank you, Erika, for having this conversation with me. It's always a delight. And to those who are watching and listening, thank you for joining us in this edition of COVID Ethics Update, which is a service of the Center for Practical Bioethics. You can find us online at www.practicalbioethics.org, practicalbioethics.org. Until next time, this is Terry Rosell and Erika Blacksher from the Center for Practical Bioethics. Thank you. Be well.
Bye, everyone. Bye, Terry.
Bye-bye.